research title is Randomized Control Trial on the Effectiveness of Home-Based Walking Exercise on Depression in Patients with Lung Cancer. The proportion of lung cancer survivors is growing worldwide and in Taiwan. Patients with lung cancer frequently experience psychological problems such as depression. The prevalence rate of depression in lung cancer survivors is 33%, so very high. Depression might limit the functional ability and impair the quality of life in lung cancer survivors. Although exercise provided several benefits for patients with cancer, the effects of exercise have been inconsistently reported in various studies. For example, as demonstrated by two previous studies, exercise can reduce depression in patients with breast cancer and other cancer. However, 4 previous studies have indicated that exercise intervention is ineffective in reducing depression in the patient population with breast, lung, colorectal, and other cancers. These studies have involved the use of various exercise modalities. For example, they use brisk walking, running, cycling, swimming, and resistance training. So including various exercise models with varying frequency, intensity, and duration, thereby resulting in inconsistent conclusions. The American College of Sport Medicine suggested that patients with cancer must perform moderate intensity aerobic exercise, such as walking and cycling for 20 to 60 minutes per session for 3 to 5 days per week to improve mood and quality of life and reducing fatigue. Walking is strongly recommended for patients with pulmonary disease because it is involved in most activity of daily living. Walking is the most preferred exercise of patients with lung cancer because it is flexible and can be performed alone in Taiwanese patients with lung cancer. A home-based moderate intensity walking program can reduce depression in patients with breast and colorectal cancer. However, research on the effects of home-based walking exercise on patients with lung cancer remains limited. So this current study aims to determine the effectiveness of a 12-week home-based walking exercise program in managing depression in Taiwanese patients with lung cancer. We conduct a parallel randomized control trial, single-center trial with a home-based walking exercise group and a usual care group. Eligibility criteria were patients who were diagnosed with primary lung cancer and were more than 18 years and were able to speak Mandarin or Taiwanese and exhibit no cognitive impairment. The excluded criteria were they had in the regular exercise or had received cognitive behavior therapy in the past 6 months, or had been diagnosed with cognitive or have been diagnosed with cognitive congestive heart disease, or have been diagnosed with lower limb orthopedic disease that restrict working ability, or have been diagnosed with repeated onset of depression. The study protocol was approved by the Institutional Review Board of Taipei Veterans General Hospital. We have 3 times for measurement the outcome variable depression. Baseline assessment at the hospital. And 2 times for follow-up questionnaire were distributed by post during the 3rd and 6th months the intervention. The exercise program was a 12-week home-based moderate intensity working exercise program consisting of 40 minutes per session, 3 sessions per week, and weekly exercise counseling. And during the enrollment period, we offer a working exercise booklet to the participant and use its content to instruct the patient regarding the mode, intensity, and frequency of the exercise, and also teaching the pulse rate measurement, both rating of perceived exertion scale, and prevention to how to prevent the sport injuries, and the time point of determining the exercise. Each participant was instructed to achieve a target heart rate of 60 to 80% based on the cover method, and a score of 13 to 15 on the RPE scale. We're using the hospital anxiety and depression scale, the depression subscale. This scale comprises 7 items for depression. Each item of depression subscale was scored on a 4-point scale from 0 to 3. Higher score indicated higher depression levels, and subscale scores of equal or more than 11 were considered to indicate a defined case, whereas subscale score of 8 to 10 and 0 to 7 were considered to be a suspicious case and a non-case respectively of depression. We use an intention to treat approach and use the SPSS software to analyze the data. Both stability and repeated relationship analysis were conducted using the generalized estimating equation, GEE. We add an interaction term to to each model to investigate the corroborative effects of exercise and time, the changes in study outcome value, depression, from baseline to follow-up period. The 3rd and the 6th months were expressed in both the working exercise and usual care groups. This is the results. As shown in Table 1, the sample comprised 116 patients and age from 37 to 88 years, which a mean age of 64 years. Most participants were married and employed, and half participants had stage 1 lung cancer and undergo operation. No statistically significant difference emerged in the baseline demography and disease characteristics between the 2 groups. And the table 2 show the mean depression score at baseline were 5 and 4 in the working exercise and usual care groups. No significant intergroup differences were observed in the mean depression score of working exercise group gradually declined from baseline to the 3rd and 6th months. However, the mean depression scores of usual care group at the 3rd month increased significantly from the baseline, revealing a marginal significant increase at the 6th month from baseline. In addition, Significant differences were observed at the 3rd and 6th months between the working and usual care groups. Furthermore, a significant interaction term of the model at the 3rd and 6th months revealed that the participant engaged in walking exhibits further reducing the in depression over time. This result indicated that the walking exercise program effectively reducing depression. From the figure 1, we also can see the black line is the walking exercise group. The patient's depression score decline over time. A cutoff point 8 was used to investigate the clinical significance of the observed changes. The walking exercise and usual care group reviewed similar numbers of defined and suspicious depression cases at baseline. Moreover, although a significant difference was observed from the baseline to the 3rd month, no significant difference were observed from the baseline to the 6th month. The significant interaction term in the GEE model indicated that the walking exercise program effectively reduced the number of the patient with depression over time. Discussion. This is the first study in investigate the psychological effects of a home-based walking exercise program on patients with lung cancer. The trial's results support the hypothesis that the home-based walking exercise exerts positive effects on depression in patients with lung cancer. These results are consistent with those obtained in previous studies on patients with colorectal and breast cancers. Our results indicated that psychological benefit of exercise observed in other cancer populations apply to patients with lung cancer as well. Regarding exercise intensity, because of constraint our research budget, we use both the heart rate and both RPE, which were measured by the patient themselves. However, accurate heart rate detection can be challenging for elderly patients. We suggest that a further study with a larger budget use a watch-like heart rate monitor to facilitate precise heart rate detection, and this would reduce the measurement error when patients measure their own heart rate, as well as the patient load for heart rate measurement, particularly on the elderly patients. In the walking exercise group, 14 patients drop out and 11 patients in the usual care drop out. The patient who drop out exhibit higher depression scores than did the non-dropout patients. This finding is similar to that study on patients enrolled in a cardiac rehabilitation program. The depression status serves as a predictor of number of exercise sessions completed and the dropout rate. We suggest that healthcare provider conducts regular follow-up of the depression status of patients and encourage them to continue exercising when conducting an exercise program. The strengths of this trial included its being the first home-based walking exercise randomized control trial to focus on Taiwanese patients with lung cancer and the adoption of a feasible and flexible exercise program. And although the lack of blinding is inventable in this type of study, it may have induced a placebo effect on the patient and an observational bias among the researchers. Therefore, the outcome assessors should be trained in standardized testing procedures to reduce bias. 3 patients reported that they could not endure the moderate intensity exercise during the first and second weeks. This negatively affected the intervention fidelity and possibly diluted the intervention effects. Okay. This study is the first documented evidence regarding the feasible and effectiveness of working exercise training program in patients with lung cancer. The study results suggest that home-based working exercise can reduce depression and elucidate the critical role of exercise in the rehabilitation of patients with cancer. Healthcare team members must comprehend and consider aided exercise as a supportive care intervention for lung cancer survivors. Thank you for your attention.
Thank you.
Thank you.